I think there's so much richness in the CAPC curriculum that can be helpful to both programs and to clinicians. I mean, first of all, there's a whole bunch of pain and symptom curriculum to help people really think about being as expert as possible on some of the pain and symptom management, of thinking about communication skills. But then I think in terms of program development, there are a lot of clinicians, because if they've worked in other models, haven't really needed to understand program development. And so really understand, what does it mean to be doing care in the community, which is outside, usually a larger hospital. What does that mean? And what is the importance of a needs assessment in that part of really understanding that and what population you're going to serve? And then thinking about the different venues, from office-based to the home to long-term care, because the delivery is going to be different in each one based on not only the reimbursement structures, but just really the structure of that entity. And so I think there's so much that clinicians need to understand as a baseline for why they should be setting up really some strong foundational principles in their growth and a business strategy to do so, because in this day and age, you can't just understand just being the clinician part. You have to understand the program part, and the same thing for administrators. They need to understand the program part, and they also need to understand some of the symptom part, and that's how you become a really good program. And I'm so excited by all of the pieces and the focus on this care in the community, because I think we're learning so much. We learn from each other. All of the CAPC curriculum really represents people who are doing the work, who understand what it takes, both the opportunities and the challenges, and so that we will be able to grow this because we're really learning from the people who are doing it. I just really think that this is really exciting times, because we've done so well, in creating palliative care in the academic setting. And so now we're in the next frontier, the next generation, where we know we're going to move it out to the community. And we want to do it well. And we have so many lessons that we've learned that we can apply. And then there's a lot of new things that we can kind of think about and integrate. And so how do we take this to the next level, learn from each other, really promote all of the high standards of palliative care that we've had, and make sure that we're going to really have those same standards in the community. We're not compromising on that. But we may also have some really better ideas to do it better and do it more efficiently.